Are activated charcoal and clay that are powerful natural antitoxic supplements safe? They are considered as safe, but they have some side effects you need to be aware of. That's what I will talk about in this video. For detailed information about clay, please read my article and watch my long and detailed video. I will put the links in the comments. In this video today, I won't talk about dosages or properties of clay or charcoal. I will just focus on the side effects. So, side effect number 1 with clay or activated charcoal. It can constipate. This is something that is quite known. So it can constipate because they are very dry powders. Actually, any type of dry powder can cause this effect. It can cause constipation or it can cause blockages in your digestive system. This will happen if you eat a lot of dry cookies, for example, or a lot of pretzels that are very, very dry. So it can happen with any type of very dry food or very dry powder that you would absorb in large quantities if you don't drink enough water. But regarding clay is particularly constipating compared to charcoal. Why? It's because clay actively absorb water. So there are some clays that will absorb water more than other clays. For example, green clays can absorb more water than white clays. Green clays are more efficient for detoxification, but they are also more absorbent of water. There's one type of clay in particular that can be dangerous if you drink or if you swallow lots of it. It's sodium bentonite clay. So in the US or other countries, you have two types of bentonite clays, calcium bentonite or sodium bentonite. Calcium bentonite is fine to drink, to take orally, but sodium bentonite should not be used. I personally don't recommend to use it neither orally, neither topically on the skin because this clay is way too strong. I explain that in my article. Again, if you want more details, go read my article or watch my other video. But yeah, sodium bentonite can swollen up to 20 times its volume when mixed with water. It's a type of clay that is used by the industry to fill holes, to fill holes in the roads, for example. Okay, so yeah, I prefer that people use it for that rather than taking it orally. Okay, be careful with that type of clay. So in case of acute intoxication, the first choice won't be clay because, as we just said, clay can swollen with water. So in case of acute intoxication, you want to take lots of natural antitoxic supplements that won't swollen so much. And the best option for that will be charcoal, okay? Because you will have to take lots of it many times per day until you get better. So again, if you take clay is a very good detoxifier. But again, if you need to take lots of it in a short period of time, it can really cause issues. It can really cause constipation or blockages. Okay, so for acute intoxication, choose activated charcoal or zeolite or attapulgite. That is one type of clay that doesn't swollen. Another side effect to be aware of, but usually people are aware of this one too, you need to take clay or charcoal at least 2 hours away from medicines, from drugs, or from other supplements, or from food. Why? It's because clay and charcoal absorb chemical molecules of different things. So it can absorb the chemical molecules of your drugs and also of your supplements. So make sure that you don't take clay or charcoal together with your drugs or supplements. Regarding food, it has been shown in some studies that activated charcoal can absorb some nutrients in vitro, that is to say outside of the body. They mixed activated charcoal with apple juice or other fruit juices, and then they analyzed it and they saw that the charcoal absorbed some vitamins and minerals. But there are other studies that were made on animals, so in vivo, on sheep and on cows, They gave them activated charcoal every day for several months. And after this period of time, they analyzed their blood and they compared it to a control group who didn't take the charcoal. And they found out that they didn't have any deficiency compared to the control group. So if you want to take zero risk regarding nutrients in your food, don't take activated charcoal with your meals. Wait until the end of your digestion. But again, studies have shown that it's actually not a problem. And regarding clay, it's not a problem either. On the contrary, clay gives you nutrients when you drink it. Again, more details in my longer video or in my article. And a third point why you don't want to take clay or charcoal with your food, it's because they both can absorb your gastric acid. So because they do that, if you eat and you take clay or charcoal and it stops the production of gastric acid in your stomach, I mean, it doesn't stop it, but it absorbs it, then you won't digest your meal as well. Okay, so you can get indigestion. On the contrary, if you are someone with gastritis or gastric ulcers, then yes, in that case, you can take clay or charcoal to relieve your symptoms. Okay, when you have gastritis or an ulcer in your stomach, you have like an open wound in your stomach, and the acidity, the normal acidity of your stomach will hurt because you have an open wound in the stomach. So yeah, if you take clay, so for this type of case, I specifically recommend clay rather than charcoal for people with stomach issues, because clay is much softer, much more smooth for the stomach. It will absorb the acidity, but it will also create like a bandage in your stomach to protect the ulcer from anything, from the acidity, but from food or from anything that could irritate it. And the best type of clay in that case would be white clay rather than green clay. Some studies have shown that clay don't represent any danger on animals' health if the amount of clay absorbed is not over 50% of the daily diet, of the daily ration of food. So that's a lot. This shows that you can take lots of clay and there's no dangers. Of course, I don't recommend that you take as much clay, but that's just to illustrate how non-toxic clay is. But again, for dosages, please read my article or watch my other video. Another side effect with clay or charcoal is that it can hurt your lungs if you inhale the powders. Okay, so they can be very fine powders, and so yeah, be careful, don't inhale. And when you pour it in your glass and then you pour water on top of it, it can create some like a type of foam because it's the molecules are very fine. And if you breathe that every day, day after day after day after day, yes, it can hurt your lungs. But other than that, don't worry too much. Another side effect with clay is that it can cause hypokalemia. That is when you have a lowering of concentration of potassium in your blood. This is a condition that happens very, very rarely with clay. It's extremely rare, okay? So don't worry too much about that. It's very, very rare. There's one case that has been reported with a 3-year-old child who had been treated orally and rectally with bentonite clay by her parents. But again, that's extremely rare, so don't worry too much. Regarding kidney failure. So if you have kidney failure, you should not take clay. Okay, but regarding activated charcoal, there are some studies that show that activated charcoal is not a problem for kidney failure, and on the contrary, it can help. So I will put the links of 2 studies in the comments under this video. So the first study, they took rats and they injected a chemical to induce kidney failure in those rats. And then they describe the problems the rats have and how the kidneys get inflamed and they have necrosis and tons of issues. So they say most of these changes in the kidneys, the bad changes, were significantly ameliorated by dietary administration of activated charcoal at a concentration of 20%. Charcoal is a useful sorbent agent, and its usability as a nephroprotective agent in human kidney disease should be studied. Another study says 9 lucid, very old, over 80 years old, end-stage renal disease patients who had refused to start dialysis were prescribed a treatment based on a combination of a very low protein diet and oral activated charcoal, 30 grams per day. None of the patients had anuria, oliguria, edema, significant metabolic acidosis, or hyperkalemia. None of them had significant gastrointestinal symptoms. After 1 week and 10 months of charcoal use, significant decrease in blood urea and creatinine levels were observed, and none of them required emergency dialysis during this time. In conclusion, in patients more than 80 years of age, low protein diet and oral activated charcoal may control the uremic symptoms effectively. Another side effect that can happen if you use clay, this time not internally but topically on your skin, is that it can irritate the skin, or it can, especially if you have an open wound on your skin, it can make it worse because it can make the red blood cell burst and also the white blood cells. And regarding the toxicity in heavy metals of clay, so many people ask that, many people wonder if you can poison yourself with heavy metals if you ingest clay. So this is a very valid question because indeed clay can absorb heavy metals. So if you consume clay that is loaded with heavy metals, yes, it can cause a risk of heavy metal poisoning. But I will read some part of my article about that question. So, in pharmacies, clays included in drugs have to prove their non-toxicity. For example, the Hypson laboratory, the distributor of Smecta, administered 200 milligrams per kilo and 2 grams per kilo of smectite to rats and dogs for 6 months. No functional or organic sign of toxicity could be revealed. And also because clay is made of aluminum, many people are worried about it. Does eating clay cause aluminum poisoning? Here again, I will quote my article. So, clay are made of a crystal lattice, to which elements such as calcium, iron, manganese, and magnesium adhere. It is necessary to differentiate the structure of this network, that is made of silicate and alumina, from the cations placed on the surface. The network is solid. Our body would have to produce a temperature of around 100 degrees Celsius for this structure to begin to collapse and release aluminum. What about the resistance of this network to acidity? Even in dogs whose stomach pH is much more acidic than ours, it seems that clay remains intact during the digestion, since toxicological studies have been able to establish that a dose of 2.250 grams per kilo per day for 1 year, a considerable dose equivalent to ingesting more than half a bag of powdered clay per day for a human, no increase in the level of aluminum in the blood could be observed. The Maison Alfort Veterinary School in France confirms that sled dogs, which receive substantial doses of clay before or during competitions to prevent or cure stress syndrome with diarrhea and dehydration, show no signs of aluminum overload. In fact, it is precisely because the aluminum in clay does not loosen from the lattice, clay leaves the intestines intact, that these minerals are so effective to heal the stomach and the intestines. Indeed, the covering power of clays allows it to cover the mucous membrane. 1 gram of smectite can spread over 100 square meters, and the aluminum of the network can thus remain in direct contact with the digestive wall for a few hours and heal it. In one study, 6 human volunteers ingested the usual dose of 6 to 9 grams per day for a month. The only control criterion was the unmodified aluminum level. So now you have it. don't worry about heavy metals and clay. Okay, that's all I have for you for today. Again, if you want more details, please go read my article and watch my video about clay. I don't have a video about charcoal yet, but I should soon release a video about it. Actually, I have one ready that I made more than a year ago, but I got discouraged because this video is so long. I have to make it again, but maybe one day I will find the courage to do it. But yeah, I do have a video on charcoal, very interesting with lots of details. So yeah, maybe one day I will release it on YouTube and you will see it. Anyway, if you have any comments, please post them under this video, and I see you in the next video. Bye bye.